Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. You know, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. So today it is a continuation of the series that we are running, that is Ayurveda in GP, Ayurveda in general medical practice. So lot of videos I have made, and every alternate day this opens at around about 5:45 p.m. This is the near about fixed time for uploading this particular my videos. So today's topic is a big topic related with very important subject, that is STD, sexually transmitted diseases. STD, they are also called as a venereal diseases. And also we will discuss some of the sexual problems in general medical practice. As this topic is a big topic, I have divided the sessions in two parts. So this is STD and sexual problems in GP part 1, and there will be another video of same length, say 20 to 30 minutes, regarding the STD and sexual problems in GP. So let us start to discuss about the sexually transmitted disease. The three important diseases that the patient comes to us, that is syphilis, gonorrhea, and chancroid. These sexually transmitted diseases or venereal diseases are taking place because of what you can say the unsafe sex. That means without using the condom or some preventive measures, especially the male, they are exposed to these particular diseases because of the contacts with the or visiting to the prostitutes or the unknown girlfriends and all these things. And unsafe sex makes these problems to be happen. Okay, and from the male partner, this can what you can say the transfer to the lady's partner, maybe his wife or maybe girlfriend. So the people who are having a what you can say this type of craze to visit the so many and enjoying the things in a different unethical way also, they can suffer such type of the problems. So be careful while visiting to the prostitutes or girlfriend, because such dangerous diseases can occur with the human being, and they can cause a lot of hazards in our life. There is a loss of name, fame, and money, all the things. So, and another is very important things to be noted. When the male visits to any prostitute or the girlfriend, he doesn't know, if he doesn't know about the whole of her life and background, then externally these particular signs or symptoms of these diseases cannot be disclosed or expressed, and the male partner unnoticedly gets contact with the lady who has already been infected with these particular problems, and then that particular male also suffers from the diseases. So he is visiting to the prostitutes and the girlfriend, and if he is married and comes to home and again get a contact with her wife, then wife may also suffer from such type of the diseases. Nevertheless, if they are the young couple, what is happening if by chance that lady also get affected with these diseases, and by chance if she gets pregnant, that particular disease is being transferred to that newborn baby also, and this cycle will spread or havoc will occur in that particular family. So my dear friends, be careful not to get such type of the serious diseases. For example, first is a syphilis disease. Syphilis is an infectious disease caused by the spirochete. Treponema pallidum is the name of that particular spirochete, and that organism usually spreads venereally. That means whenever a person does the intercourse or the anal sex or the oral sex, this particular disease can spread. The danger of this disease is that its incubation period is too long. For example, from 30 days to even 90 days. On an average, it is a 21 days, that is a 3 weeks, but still it is a big time. What does it mean by incubation period? After visiting to the prostitute or the girlfriend who is having these particular diseases, the male gets affected, but it is not immediate. Immediately after second day, third day, or even that particular hours, it is not happening. He visits to that particular prostitute, and till the completion of the 1 month, 2 month, even up to 3 months, any time that symptoms will start to develop. But by that time, that particular person forgets that he had such type of the contact, and because of that wrong contact, he has suffering from this particular problem. So this thing is very, very dangerous. About this syphilis, incubation period is too long, from the 3 days to the 90 days, or 30 days to the 90 days. I think I will just yes, on an average, it is 10 days to 90 days. So this period is too long. After 10 days, okay, at least he will understand, okay, this may be the effect of that what I have visited to the prostitutes and having done the intercourse without the condom. But what for the others? If it is symptoms are developing after 3 months, the person is already forget. And another important thing, the syphilis is giving you the ulcer to that particular patient, syphilitic patient, on the penis. But most important, that ulcer is not paining. Remember my words, painless ulcer, or it is also called as a chancre. And that painless ulcer is a danger. Why? Why, doctor, you are calling like that? Because the person himself always have a tendency to neglect. If it is not paining, if it is not giving such a trouble, then the person say, okay, it will go automatically. And then he don't take any standard allopathy or Ayurvedic any treatment. And then that particular syphilis disease goes on spreading. So this is maybe the primary syphilis, secondary syphilis, or tertiary syphilis. Even after 2 to 5 years, it can go directly to the nervous system. So the disease can spread up to the brain or nervous system, and the patient will suffer from some neurological problems like tabes dorsalis. And in that tabes dorsalis, there is a problem like the tremors in the hands. And that what happens actually, that particular young chap at the age of 18 or 20, he got this particular syphilis primary infection. He don't receive proper treatment with the penicillin or Ayurvedic treatment, and then the disease go on spreading in the body from the inside. And when he gets married, after marriage, after few months, the particular husband, he finds that there are tremors, and they visit doctor, and doctor can expect maybe there is such type of the cause. He start inquiring whether you had some this type of the unsafe sex and all these things, and the history revealed that yes, he had that infection 7 years back. So this is the tragedy of this syphilis, that the painless ulcer is a problem, long incubation is a problem, and tertiary affecting the brain and nervous system is the biggest problem. So be careful, my dear friends. Classification: congenital syphilis from the infected mother, acquired syphilis, for example, early syphilis, primary, secondary, and early latent. Then late syphilis, late latent. This is a printing mistake, my dear friend. It is not talent. It is not talent. It is here the same word, latent. Benign tertiary syphilis, cardiovascular syphilis, and neurosyphilis. This neurosyphilis is a main problem or the danger. Now, what to do? Immediately, if you have such type of any person, any patient has this type of activity, unsafe sex, then he should do the VDRL test within that period. Say, for example, immediately and after 1 month, then confirm. What is the full form of venereal disease? Venereal Disease Research Laboratory. This is a simple blood test. Every suspected patient should do this particular test. Now, what to give according to the Ayurveda? What type of Ayurvedic management is there? So here you can see there is a strong medicine like Vyadhi Harana Rasa or Ashtamurti Rasayana, 2 tablets 3 times in a day. For example, like Baidyanath Company. Then for blood purification, this is for curing the Treponema pallidum bacteria, killing that particular organism. This particular drug will act. But then for blood purification, Mahamanjishtadi Kadha, 4 teaspoons with equal amount of water. This is one prescription. Then at some time you can, if it is a minor type of the, say, very simple case, then supportive medicine in addition to the penicillin. For example, we give the Penidure injection, penicillin, LA24, one on each buttock. This injection is very powerful against the syphilis. So I will say, even if you take the Ayurvedic treatment, you must also get treated with the injection penicillin. That is a more comfortable because it is a 100% guarantee of killing that particular organisms. So supportive medicine should be taken. Arogyavardhini 2 tablets 3 times in a day. Kamadudha, this is our anti-pittagna, to healing of the ulcer naturally or in physiological way, not pathological. 2 tablets 3 times in a day. Praval Basma, 2 tablets 3 times in a day. Then there you can add some other medicines, like for example, antibiotic, Ayurvedic antibiotic, Gandhaka Rasayana, 2 tablets 3 times in a day. Then Mahatiktaka Ghrita. This is a bitter and this is Amapachak. So it is very useful to eradicate that organism's infection or the Ama, 2 teaspoons with warm water. Then Rakta Shuddhikara Kadha from Hari Parshuram Aushadhalaya. HP means Hari Parshuram Aushadhalaya, Ayurvedic pharmacy from late Khadiwale Vaidya, very famous Vaidya from Pune. His son is now practicing Vinayak Vaidya. 4 teaspoons with equal amount of water 2 times a day. My dear friends, another prescription, Tala Sindur, Vaidyanath Company, 60 to 125 milligram 2 times in a day with honey you can take. For local application on the ulcer, there is a Kajjali Malam. It is not readily available. One has to get prepared from the Vaidya. Then Amir Rasa, 25 to 100 milligram. You can take this with the resins. Okay, regimen, keep away from the sexual activity till the cure is obtained. 100% cure should be there. Avoid the spicy, hot, pungent, and sour foods which will irritate that particular mucosa. Now we will discuss another disease, like for example, gonorrhea. Gonorrhea is also a STD, venereal disease, after visiting to the prostitutes or the infected girlfriend. Infectious disease caused by the gonococcus, Neisseria gonorrhoeae. What you can do? VDRL you can do, but at the same time, you can take the pus smear for the gram stain. That means in the male, he will complain of after 3, 4, 5 days that I am having very severe burning. Urination is there. Urine is burning while passing the urine. So severe burning will be there, which is called as a dysuria. And also simultaneously, there will be pus discharge per urethra. Yellow, white color discharge will come. And that's why, like syphilis, this disease, the patient cannot hide. Patient cannot hide this gonorrhea. Syphilis can be hid because painless ulcer is there. But here, severe urethral pain will be there. Pus will be there. And all the undergarments will be spoiled. So he will definitely go to the doctor and take the proper treatment. But here you can do the smear to check the pus. What we can do according to Ayurveda, for example, Upadansha Kesari. This is a tablet, 2 tablets 3 times in a day. Chandra Prabha tablet, 2 tablets 3 times in a day. Then Ushira Asava. Ushir is a khas, that is a typical type of the grass which is cooling in nature. So in all sexual transmitted disease, there is a Pitta Prakopa and also Rakta Dhatu Dushti is there. Because heat and hot, these properties are increased at the reproductive system. So my dear friends, Pittagna treatment is beneficial and antibacterial treatments or antispirochete treatment is useful. Ushiraso is giving the cooling effect, relieving the burning micturition, dysuria, 4 teaspoons with equal amount of water 2 times after meals. Sarivadhyasava, Sariva means Anantamud, which is the best blood purifier, 4 teaspoons with equal amount of water. And Chandanadivati. Chandan is a sandalwood. So this is also very cooling, powerful cooling effect. So 2 tablets 3 times in a day. My dear friend, the third disease of this STD part 1, that is a chancroid. This is also a sexually transmitted disease from the infected prostitute or the girlfriend with unsafe sex without using the condom and doing it unnaturally. For example, anal sex or the oral sex that are more dangerous than the normal intercourse. Okay, so it is an acute venereally transmissible auto-inoculable disease of the individuals with poor hygiene and is caused by decreased bacillus, a gram negative. Remember this. Many of the organisms are gram positive, like tonsillitis, pharyngitis, appendicitis, but this is a negative, gram negative streptococcus called as a Haemophilus ducrei. Very, very funny name. Haemophilus ducrei is the name of that particular organisms. Investigation, again here smear of pus or unruptured bubo stained by Graham's method is made and the causative organism H. ducrei are identified. My dear friends, here again the symptoms are little different. For example, syphilis, painless ulcer, Gonorrhea, lot of urethral discharge and burning menstruation. Here, multiple small ulcers. Chancroid, multiple genital penis region, there will be multiple small ulcers. And another thing is either on the right or left side, in inguinal region, there will be lymph gland enlargement. That is called as a bubu. Bubu, remember this word. And there you can take the pus sample and find out these particular organisms. Now, how to treat these patients? Here you can see there is a Chopachinyadi Guguru. Chopachinyadi Guguru, 2 tablets 3 times in a day. Then Malla Sindur, 100 milligram, plus Swarnaraja Vangeshwara, 250 milligram, 3 times in a day. Local application to the bubo, inguinal region, lymph gland is enlarged, Lepagori for inguinal swelling. Sexual problems in GP. Now we have completed the venereal diseases or STD. We are talking now about sexual problems. There are mainly 4: nocturnal emissions, masturbation, impotency, and infertility. So let us talk about the nocturnal emissions for a particular age, because there are a lot of misunderstanding. My dear, all the viewers, I request you, there is one playlist. There are a lot of videos I have made, nearly 20 plus videos about the sexual education. So please visit and see the playlist of that particular sex guide type of the playlist, where a lot of things I have discussed about the sexual activities. Now, this nocturnal emission has unnecessarily a tension in the mind of the youngsters and even the society. They are not looking this particular problem as a sympathetic problem, but they are always criticizing on that young chap. And that is a very bad thing, because for particular age, like adolescent age, 15, 16, 17, 18, 19, etc., nocturnal emission is normal. This thing, basically, there is totally misunderstanding. So everybody should understand that nocturnal emission is not abnormal. Educate the patient and train him to control behavior of the hormones by good company, spiritual literature, and proper exercises, physical exercises. Wrong information or bad company at this juncture, that is adolescence, can damage that particular young chap's health for good. So in these changes are handled and controlled, no harm can be done by the normal emission. So again, I will mark for you. Following treatment helps to pacify the effect of excessive testosterone hormone and phase of sexual transformation. So there is tablet called as a Spemen 4 from Himalaya company, 2 tablets 3 times in a day for the nightfall. Then Prashama to tranquil your mind activity, 3 tablets at bedtime. Another prescription, my dear friends, for this nocturnal emission, Vangabhasma is the best one to control the testosterone hormone. 60 milligram plus Swarnaraja Vangeshwara 100 milligram. Kurasani Ova for mental tranquility and distress 125 milligram 3 times in a day with ghee and honey. These are the catalysts. And there is the Allersin company Siledine tablet to again anti-stress to tranquil the mind, 2 tablets at night. Now another prescription for nocturnal emission is like this. Chandra Prabha tablet with Shilajit, 2 tablets 3 times in a day. Neo is the name of the tablet from Charak Pharma company. They are colored tablets and silver coated, 2 tablets 3 times in a day. Pravalvati Antipitta, Hari Parashuram Aushadhale from Pune city, from late Khadiwale Vaidya, 2 tablets 3 times in a day. Chatavari Kalpa from Ayurveda Rasashala Pune, 2 teaspoons 2 times in a day with milk. And then Nidra Karavati, 5 tablets at bedtime. So this is all about the nocturnal emission. The same problem is occurring with this particular thing, that is a masturbation. Many, even the seniors, they are looking towards this condition as a very, very abnormal, and they have a lot of misunderstanding. Masturbation is a sexual stimulation of a person's genitals, often to the point of orgasm. Men and women have techniques and characteristics in common. Although this particular masturbation activity is normal, excess Anything excess, always in the life, can cause the loss of energy. So good company, satsangati, spiritual literature, and exercise can help to utilize the unnecessary loss of vital energy of life, that is the sexual energy. If the energy is preserved at proper time, mental peace can be achieved. And that's why in our Indian culture, we have the different phases of life. From birth to the age of 25, we are calling it as a Brahmacharya Ashrama. What is that Brahmacharya Ashrama? The lifestyle made for acquiring the Brahma Jnana, that is knowledge for our family life, knowledge for earning the money, knowledge for society relationship. So this knowledge is important for the first 25 years of life. 25 to 50 years of life is a family life, Grihastha. From 50 to the 75, that is Vanaprastha, retirement. And then after 75, that is Sannyasashrama, total detachment from the materialistic world. Okay. So this is essential when we want to divert our sexual energy. So what treatment you can prescribe? First is a Spemenford, Himalaya company, spelling mistake is there, 2 tablets 3 times in a day. This should be SPE. Kurasani Ova to tranquil the mind, 125 milligram 3 times in a day with ghee. Ayurveda Rasashala company has developed Prashama. Oh, Shanta, Shanta, Prashama. Prakarshena Shanti, Prashamaha. So, to give the very quiet and calm and Sattva Guna Pradhana mind, you must take this Prashama liquid or even tablet, 2 tablets 3 times in a day. Manasamitra from Aryavaidya Shala Kottakal, 2 tablets at bedtime are beneficial. So, my dear friends, I understand that you have understood the whole concept of sexually transmitted disease. And today we have discussed about the syphilis, gonorrhea, and chancroid, and also discussed about the nocturnal emissions. And what else? The last one was masturbation. In all these topics, I have the detailed and separate videos on my channel. So please check those videos also. Thank you very much once again. And I request like, share, and subscribe my YouTube channel. Thank you very much. We will see in the next video. Till then, swasth rahiye, khush rahiye. Dhanyawad.